está corriendo, ¿verdad?
Sí.
Hi everybody, good afternoon. We're here in Rosarito Beach. We're on the grand opening of our rehab of drug substance abuse house. We're here with my partners, the lawyer Mari, and psychologist from Las Vegas, William. So we saw a lot of problem and substance abuse, and all this area of a lot of patients who come in for a surgical process, and they talk about their families and substance abuse can come up really often. And well, as a doctor, I know that that's really common. Um, there's a lot of dependence. So I talked to my partner and we team up, and we are also now in the rehab business. So tell us a little bit about your work, my friend.
Well, I have a PhD. I'm a doctor as a clinical psychologist in United States. All my education is there. I specialize in addictions also, but the biggest thing I specialize in trauma. We developed this theory with Dr. Jay Norris about neuroscience that really cures people with mental problems. We go into the memories and we rescue the people, and we're able to neutralize the negative emotions. So now most of the clinics, I have to tell the truth, most of the clinics, they don't know how to work trauma. Most people that come here to this rehab, they don't only have the substance use disorder, but they do have dual diagnosis. They have anxiety, they have panic attacks, they have severe depression, they have psychosis, they have schizophrenia, they have OCD, obsessive compulsive disorder, they have PTSD, post-traumatic stress disorder. So when they don't work in their trauma, what happens is that their chances of maintaining their sobriety are lower, because the reason why they relapse is because they don't know how to work with their emotions, with their depression, with the trauma. So we analyze their personality and we work individually with trauma. Every week they have a session, not only group sessions but individual sessions. I team up with Dr. Oscar and the lawyer over here that she works with the team of lawyers to make everything legal. So I think we have a great team and a great facility, and the most important thing, Oscar, is that this is really affordable. We're right next to the beach. It's a nice place, great area, one of the best areas of Rosarito. The Marines are right in the corner, so it's pretty safe for you guys to consider bringing the people over here. We have treatments from 6 months to a year. Now, why do we have treatments for 6 months to a year? That's what research shows. Research shows that the treatments that really work has to be from minimum 6 months. If you take your sons or anybody in your family for treatments for 1 month or 2 months, they're gonna steal the money. They're not gonna do anything. Mentally, psychologically, the person who has a severe addiction, they need at least 6 months to clean up their brain, to clean up their emotions. So we're gonna have a really higher success if they're here from 6 months to a year. And talk to us. We really affordable compared to other clinics, and we are the only clinic specialized in trauma, not just with the substance abuse but trauma. And when I say trauma, is that every mental disorder that a patient has to do with trauma, with mental health disorders, which is depression, anxiety, at least depression or anxiety, or other compulsions, because addiction started since they were a baby, through the violence that they grew up or through emotional problems that they encounter. So now will tell us a little bit about what is that you do.
Hi, my name is Mary, and our objective is I want to add something that is real important to recover. And that important thing is that we're going to take care of our patients with love and respect. So that is the most important part of
Compassion.
our compassion, and we want them to recover and to gain their self-esteem and to be a good human, a good for the society, and also that when they leave our
Facility.
yeah well, when they leave from here, we want them to go and to to socialize with their family, to learn, also to socialize in their job and to work with with different kinds of people, and to do their best. So that is part of our objective. So that is what I have to say. And of course, we're gonna make our best effort to um, to help them. So
Another thing that I want to emphasize is that this is a clinic. This is a mental health clinic with a specialty in addictions. Which means this is not a place where they're going to treat you bad, where they're going to use physical abuse or emotional abuse or things like that. That happens a lot, unfortunately, in a lot of places in Mexico. Here they're going to have detox, they're going to have a psychiatrist, they're going to have licensed psychologists, they're going to have a team of professionals to provide the best services. It's not going to be like other places where they treat people with disrespect when they get beat up, when they get abused physically or emotional. We are a clinic. Not everybody qualifies for that, but we also work with their behavior if it's not to the stream of violence. So talk to us. We're here to provide a great service. And like I say, is the only clinic that is specialized in trauma. The main reason why people continue relapsing is because nobody knows how to work with emotions. And my own concept of trauma, I specialize in trauma, which is called life ecology or partial memory. That's the name of Jay Norris. We work with the subconscious mind. We go into their memories. We do a rescue. We neutralize the painful emotions that leads them into continue using drugs and alcohol. So we are really happy to have this team. I think this is a blessing, and the females are going to be separated. It's for male and female, but the females are going to be separated so that we can work individually with them, and it's all structured with as a clinic specialized in mental health and addictions.
Yes, and we are also going to do a lot of medical treatment that involves oxygen treatment in hyperbaric chambers, and also ozone, which will regenerate the neurons. So that's basically why we are teaming up with a U.S. specialist, and so that he can also see you when you get back to your home at the U.S. And we're going to have follow-ups online, even with the 12 steps meetings, and we're with our psychologists also. So it doesn't have to, you don't have to spend a lot on rehab. Like normally patients here in the United States, they spend like thousands of dollars, between 10 or 14 for a month of rehab. Right here it's really affordable, and we have the ocean. It's a really nice place that you can come back and get in touch with yourself again, and end with an addiction in case you have one.
And also you have the opportunity of having your own room. Just of course you're gonna have to pay a little bit more, but you're gonna have VIP room, your own room, with which some people can afford it, and it's not going to be much of a difference, but it's really affordable still for anybody, because some people have anxiety, panic attacks, depression, and they need their privacy. So we have all these a very high structure. I've been doing addictions for years. I specialize in domestic violence, I specialize in trauma, so we're ready to provide the best services. So thank you very much, and go ahead and give us a call. We're here to help you. We're here to answer all your questions, and I hope that you make that decision before it's too late. Before it's too late. Before your son or your daughter get an overdose, and then there is not going to be a chance. So call us, and we're here to serve you.
Yes, because it's a medical fact that addiction kills thousands of people around the world. So that is a fact, and well, we want to do something about that and help you. Okay, well, have a good weekend.
Thank you.